And now to our coverage of the novel coronavirus pandemic.
The Nigeria Center for Disease Control, that's the NCDC, reported 595 new cases overnight, taking the country's total number of cases to 33,153. Lagos recorded the highest number with 156 cases, followed by Oyo with 141, the Federal Capital Territory 99, Edo 47, and Kaduna 27.
Now, these 5 states and 15 others make up the daily total of new cases. Now, so far, 13,671 people have been discharged, while 744 others have died from COVID-19 related complications. Now, the World Health Organization says it is very unlikely that countries can eradicate COVID-19 right now.
What this means is that the world will have to learn how to live with the coronavirus because it is not likely to go away soon. The health body says countries may need to reinstate some lockdown measures as clusters of cases quickly become outbreaks that can spread like a forest fire.
WHO is worried that the virus has continued to accelerate and is not under control in most parts of the world. All right, joining us on Skype from Kano is Dr. Usman Bashir, a public health physician. Dr. Bashir, it's good to have you join us right now. Thank you. A lot of people are really concerned as to all the protocols that experts talk about. Even in cases where they are being adhered to, we still see these numbers rising. But what more can anyone do, especially for us here in Nigeria, to change things?
Like we always say, the first thing is personal responsibility. The government cannot do it alone. So, and it seems we are veering off the road because we don't wear face masks. We've taken social distancing to the dustbin of history, and then we don't even the places where we're supposed to, public places that are supposed to have wash hand basins and other sanitary hand washing mechanisms are not really there. So we really need to work, and we can see the numbers are rising by the day. We're now before we were in tens, now we're in 500s. And we don't pray to go into the Americas because Americas are turning out numbers in thousands. So we need to really observe those, like the WHO said, we are not there yet. So it's not yet time to celebrate. We need to really strengthen our measures, meaning that the numbers we are seeing are still not the end of the road. So we really need to gear up, tidy up as nations, because the WHO cannot do it alone, Nigeria cannot do it alone. So we need to come together collectively as humanity to take the new normal, like we always say, adapt to the new normal, and put it as life for the time being.
All right, let's take a closer look at the statement by the WHO saying that this would not be living anytime soon. What does this mean for countries that are yet to peak and that are struggling with perhaps health care and still struggling with dealing with the virus?
Like we said, like resource-constrained countries like Nigeria, we need to really up our game. We need to improve our testing capacity so that we can find those with the disease and isolate them, and also protect the vulnerable group among us, especially the elderly and people whose underlying medical conditions who are at risk of having the severe form of the disease. So we need to really also have our own in-country mechanisms. We need to adapt the WHO strategies, but make them adapted to our situations we have in our country, so that the economy, even though, like we said, the economy is the country is open because of the economy, not really because the disease has gone. So we need to really engage the stakeholders, the relevant stakeholders, religious bodies and other community people, to inform them that this thing is here, may stay for a long time, and we need to do more because our fear is the second wave. We don't want to have the second wave. We're already in the first wave, and in the past 100 years, where we had the same scenario whereby when the thing tapered down, people came out and started celebrating. Little did we know that it has not gone. So that is why we're trying to put caution, and the WHO is raising the alarm that countries need to strengthen their systems, need to put in place mechanisms that will deter the disease from a comeback, which we are not praying for. But we need to be alert, we need to be proactive, we need to put on mechanisms that will help the process of picking up this disease.
Okay.
Now, one of the things with regards to roadmap to addressing this issue stated by the WHO is that we need strong government leadership and coordination of comprehensive strategies that are communicated clearly and consistently. How do we go about that when you look at Nigeria? Have we provided the needed leadership, and how do we move on or build on what we have done so far?
Yes, we can say in Nigeria, efforts are being made, but like we all see around the world, personal commitment is very key. Even if government puts all the infrastructures, the materials needed, the manpower, if you don't have the personal commitment of the populace for them to own up and take care of this kind of pandemic. And like it has been said by the World Health Organization, it's not yet over. The fire is still on, and we need to put on our strategies. We need to, like you can see now, people have abandoned face masks. People don't observe the social distance as it's supposed to be. Hand washing facilities are not provided in most of our outlets. So people need to make sure that they observe those things, because this thing is still with us, like the WHO have said, and we can see the numbers are rising. In Nigeria, it was in 10. Now it's in hundreds. We're not praying for it to be at thousands. But the way things are going and the way we are handling things, we need to really put on strategies, especially involve the major stakeholders like the religious bodies and our traditional institutions to reinculcate and then reinforce the knowledge people. And we should make sure that we pass the message across and people should comply as needed.
All right. Now, Dr. Bashir, there is a call for new measures to be put in place when it comes to some form of restrictions here and there. We've seen in the United States where some states are reconsidering the idea of opening up for people to, opening up business and opening up their states. Would you recommend that there should be some form of restrictions again in order to flatten the curve?
As we see, even though people take, like I said, each country needs to adapt its own situation. But as we can see here in Nigeria, things are really going up. So some restriction need to be put in place. But people need to be aware of this, that if we don't do this, this is what will happen. That means if people don't comply with, as we are seeing now, with the restriction, even though now there's relaxation of the lockdown and all those things, and as we have been saying, the opening is for the economy, not that the virus has come. So, and then it is possible that if things get out of hand and then we don't comply and the numbers are rising, there's need for the government to strategize, meaning that even lockdown can be reinstituted in areas where there seems to be numbers that are rising, and like in where we have pockets of infection, so that it not spread around.
All right, Dr. Usman Bashir, thank you so much for speaking with us.